How do copayments and coinsurance work with Medicare's out-of-pocket max? Have you ever wondered how copayments and coinsurance fit into the big picture of managing your Medicare costs? Let's break it down in a simple way. Copayments are fixed amounts you pay for specific services, like a doctor's visit. For example, you might pay $20 each time you see your doctor. On the other hand, coinsurance is a percentage of the total cost of a service that you pay after meeting your deductible. For instance, if you have a hospital bill of $1,000, you might pay 20% of that amount after your deductible is met. Now, let's talk about Medicare's out-of-pocket maximum. This is the highest amount you will pay in a year for covered services. Once you hit this limit, your plan pays 100% of covered costs. However, not all Medicare plans have this feature. In Original Medicare, which includes Part A and Part B, there is no out-of-pocket maximum. This means that your copayments, coinsurance, and deductibles can keep adding up without any cap. For example, if you are hospitalized under Part A, you will pay a deductible and daily coinsurance for extended stays. These costs can accumulate significantly over time. In contrast, Medicare Advantage plans, also known as Part C, must have an out-of-pocket maximum for covered in-network services. For the year 2025, this maximum is capped at $9,350. Once you reach this limit, you will not have to pay any more copayments, coinsurance, or deductibles for covered services for the rest of that year. This feature provides a safety net against high medical expenses. It is important to remember that the out-of-pocket maximum applies only to covered services. It does not include your monthly premiums or costs for services that Medicare does not cover. In Medicare Advantage plans, your copayments and coinsurance do count toward reaching that out-of-pocket maximum. On the other hand, Medicare Part D, which covers prescription drugs, has its own separate out-of-pocket limits for medications. Understanding how copayments and coinsurance work with Medicare's out-of-pocket maximum can help you manage your healthcare expenses more effectively. If you have a Medicare Advantage plan, once your total copayments, coinsurance, and deductibles reach the out-of-pocket limit, you will no longer pay for covered services that year. This can provide peace of mind and protect you from unexpected medical bills.